Hello, everyone. Welcome to the Newsbrowse News broadcast. Prime Minister Mark Carney is actively promoting the start of construction at the Nouveau Monde Graphite's Matawinie mine in Quebec. This significant project is poised to become the largest graphite mine in North America, with an anticipated annual production of 106,000 tons. Carney highlighted that the project, fast-tracked through Canada's Major Projects Office, signifies an unprecedented pace in bringing Canadian resources to market. It is expected to inject nearly $2 billion into Canada's economy and generate 1,000 jobs across various skilled trades and engineering fields. Given graphite's critical role in electric vehicle batteries, defense, and aerospace technologies, Carney expressed ambitions to export Quebec's graphite to international trading partners like Japan and Italy. The federal government is further supporting the initiative with a $459 million financing package and a guaranteed sales price for 30,000 tons per year over 7 years to strategic customers. Construction is projected to last 2 years, with full commercial production aimed for late 2028. While local residents and an opposition coalition have voiced environmental concerns regarding the mine's impact on local forest, water, and air quality, the project has received support from the chief of the Atikomek-Mastic Nation of Manawan. This report is from the Canadian Press. The union representing Canada Border Services Agency workers has expressed disappointment, as reported by the Canadian Press, over the federal government's decision to provide $238 million in funding for private sector guards at immigration holding centers. Of this, $153 million will come from existing departmental resources. The Customs and Immigration Union argues that federal public service law enforcement personnel should carry out this work. Union President Mark Weber cited the 2014 Jimenez case, where a detainee died in a privately staffed facility, as a tragic example of relying on the private sector. He emphasized that personnel guarding high-risk individuals in detention facilities should be of the highest caliber, a standard he believes the private sector has failed to consistently meet. A CBSA spokesperson clarified the funding is to ensure uninterrupted service as existing guard contracts expire, with CBSA staff retaining overall responsibility for detainee care and oversight. Newswire.ca reports that Guac Mex Grill, one of Canada's fastest-growing premium fast-casual Tex-Mex brands, has officially announced its entry into the Indian market. This significant expansion is made possible through a master franchise partnership with FranGlobal, granting them the rights to develop and grow the Guac Mex Grill brand across India. This strategic move aligns with Guac Mex Grill's long-term international growth ambitions. As part of its launch, Guac Mex Grill and FranGlobal are scheduled to participate in the upcoming Franchise India Show 2026 in New Delhi on May 16 to 17, 2026. This event will serve as an official introduction to the Indian franchise market, offering a platform to connect with prospective multi-unit operators and development partners. The brand's concept focuses on efficient restaurant footprints, strong delivery performance, and a menu featuring bowls, burritos, tacos, and house-made sauces, emphasizing bold, crafted flavors. City News Everywhere reports that the BC College of Family Physicians, BCCFP, is actively campaigning for significant improvements in primary healthcare conditions across British Columbia. On BC Family Doctor Day, the organization's president, Dr. Jennifer Lush, and other representatives met with members of the Legislative Assembly, MLAs, to advocate for crucial changes. A primary concern is the excessive administrative burden faced by family physicians, with doctors reportedly spending between 25% and 50% of their time on paperwork. This administrative load, described by the Canadian Federation of Independent Business, CFIB, as digital red tape, amounts to 3 million hours annually province-wide, hindering patient care. The BCCFP is specifically requesting a provincial electronic medical records consolidation strategy to streamline digital systems, thereby increasing efficiency and allowing physicians more time for patients. Additionally, the BCCFP highlights the urgent need to support rural doctors, citing frequent emergency room closures. They are calling for increased efforts in training, recruiting, and retaining rural family physicians, noting the success of real-time virtual RTV support in 168 rural and First Nations communities. Expanding such initiatives and offering more rural training opportunities are seen as cost-effective ways to alleviate pressure on emergency services and enhance patient access to primary care, improving both outcomes and physician retention. Radio Canada International reports that Canadian health authorities are closely monitoring a severe Ebola outbreak in the Democratic Republic of Congo and Uganda, which has already claimed at least 134 lives in the DRC, with hundreds of suspected and confirmed cases across both nations. Despite the World Health Organization declaring it a public health emergency of international concern, Canada's Public Health Agency, PHA, is not imposing travel bans or actively testing arrivals from affected regions, instead following two guidance. This contrasts with the United States, which has increased screening and restricted entry for non-U.S. passport holders from Uganda, DRC, or South Sudan. PHA advises Canadian travelers to these regions to practice enhanced health precautions and report any symptoms upon arrival. That's all for this video. Thank you for watching. See you in the next video.